Hello and welcome back to Yashoda Hospitals online segment Know Your Doctor session. Obesity is not just a mere cosmetic consideration, but it is a leading cause to various other diseases and death as well. Obesity has become a major concern, especially among the young population, and it is a leading cause for heart attacks and diabetes. So we are here today to discuss about obesity and various weight loss surgeries and other diets. I'm Dr. Lakshmi, and let's welcome Dr. M. Manisegaran, Consultant Surgical Gastroenterologist from Yashoda Hospitals, Malakpet. Welcome, Doctor.
Thank you, Lakshmi.
So, Doctor, why do you think that obesity is so common, especially among the younger population group, and what do you think the cause for this could be?
Yeah, as rightly said, Lakshmi, obesity is becoming an endemic and maybe a pandemic. And if you see the CDC criteria 2018, almost 40% of Americans are obese and 15% of children are obese. So in India also we are not lacking behind, and we are also almost following the West in obesity, and we are also seeing lots of childhood obesity. Obesity as such is an independent risk factor for most of post-operative mortality and morbidity, and also we see that obesity is the leading cause of many cancers, hypertension, type 2 diabetes, hyperlipidemia, then major musculoskeletal problems like disc prolapse, osteoarthritis, and also stress and urinary incontinence, and also we are seeing in young women's menstrual irregularities and infertility. So tackling obesity is a major problem, particularly in a developing country like India, and in view of the morbidity and mortality associated with it, we need to have a good concern to tackle obesity in the beginning, that is mainly prevention, and then once obesity occurs, to manage it properly.
So you've just mentioned that pediatric obesity in India is also fast growing up, and I'm sure that's a new terminology. So how do you think we should tackle obesity in this developing world with sedentary lifestyle especially?
See, to tackle obesity, the main thing is prevention. So how do we prevent is, the two main factors are exercise. Exercise is a mainstay of reducing obesity. A daily physical activity of at least 1 hour is important. The second thing is diet. As you see that because of westernization, we are taking a lot of foods which are unhealthy, particularly the energy rich foods and junk foods. Adding to it lack of physical activity. So to tackle obesity, the mainstay is, one is diet, and second is physical activity, regular exercise at least 5 times a week.
So doctor, if one is diagnosed with obesity or being overweight, what is the first line of treatment that is usually recommended?
To categorize people as obese and also to advise treatment, basically we have some criteria. The main criteria is the body mass index. So the normal body mass index should be around 18 to 24.9. So if you're come into overweight, that is the time we should be cautious and take precautions. The main treatment for obesity is diet, exercise, and then if both of these things are not going to help you, and if you come into the surgical category, then you need bariatric surgery. When your BMI goes above 32.5, and that is the time which you need to have surgical management. The main the obesity related comorbidities are diabetes, hypertension, obstructive sleep apnea, hyperlipidemia. These three, if are there, then we might have to plan for early surgery. Sometimes we go for surgery even if the body mass index is around 30 kg per meter square.
So doctor, we've just discussed about the bariatric surgery. So one question that is common on everyone's mind is, how long does this weight loss surgery last? I mean, is the weight loss forever, or does one put on the weight even after surgery?
This is a good question and a big concern, and a lot of misunderstandings are there in weight gain after surgery. So there is a little difference between what we do in bariatric surgery and what we do in liposuction. In bariatric surgery, we don't touch fat. We use fat which has accumulated over the years as an energy to supplement post bariatric surgery. After the surgery, over 2 years, they lose weight. Subsequently, after that, if at all they gain weight, they will gain only 10 to 15%. If they gain more than that, or the BMI is more than 50% of what we have corrected, then it is a failure. The causes of failure can be either patient related or it is maybe related to the surgery. Most of the time, it is combination of both.
So doctor, I'm curious to know, if one puts on weight even after surgery, can it be done for the second time as well?
Yeah, we can do it, and it is again what we call it is a revision or a redo bariatric surgery. So we need to look in detail on these patients. First we have to see what are the nutritional requirements, what was the dietary intake, because it's again a team of people who are going to assess the patient why they had weight gain. So if the weight gain is because of wrong food habits, we need to correct it. If they're not doing good physical activity, we have to train them, and we have to make them do proper exercises. And third thing, if it is surgery related, then we will have to see what type of surgery was done and why it has failed, and then we can redo the surgery.
So in general, doctor, what is the recovery time period after one undergoes the surgery, and when can they get back to normal life activities?
The recovery is very fast. In fact, if you see most of our surgical patients, because we do almost most patients with laparoscopy, the recovery and convalescence is much faster than the open bariatric surgery. If you see on an average, my patients stay there only for 4 days. They ambulate 2 hours after surgery and get back to work in a week's time. Subsequently, these patients will be put on liquid diets for 2 weeks or more to adapt, and then they can take normal diet advised by our dietitian. So the recovery takes just a week's time, and the more active you are, the faster you lose weight.
So apart from losing the excess weight after undergoing bariatric surgery, what are the other advantages that a patient can have?
Well, the advantage is phenomenal. If you see the risk-benefit ratio, the benefit is much better. See, as I told you, the obesity-related comorbidities, mainly diabetes, hypertension, obstructive sleep apnea, and menstrual irregularities. So we almost have a resolution rate, or we can say a complete relief from diabetes in 70 to 80% of patients. Relief from hypertension in around 70%. Relief from obstructive sleep apnea. See, this obstructive sleep apnea, a group of patients who are going to have this BiPAP mask and oxygen lifelong, and sometimes they have sudden death during sleep. So almost 85% of them will get relief from the mask and free of oxygen. And the quality of life also is much better in them. And we have patients who were infertile and have conceived after surgery. One precaution in patients who choose to become pregnant, particularly in women after bariatric surgery, it should be advised to have children after 2 years.
So before ending this episode, what message you would like to give in combating the new pandemic, that is obesity, to the general population out there?
The most important thing, as I stressed, and again I will do stress, is a healthy lifestyle. You start a day with the exercise and end a day with the exercise. Take proper food, avoid junk food, and then patients, once you see that you are gaining weight, we need to evaluate why you are gaining weight. Consult a physician, consult an endocrinologist, see if any hormonal deficiencies are there, or is it due to binge eating, which all need psychiatric consultation, and reduce weight. Once the body mass index comes into the surgical group, I think you need to meet a bariatric surgeon and undergo surgery, because apart from the obesity related diseases, even the lifespan is almost improved by 10 years after bariatric surgery.
So doctor, what is your fitness mantra that do you follow regularly?
Yes, my mantra is start cycling in the morning. I do around 30 kilometers a day. On Sundays I do 100 kilometers. Then I go for my routine work, and then end my day with either 2 or 3 sets of badminton or tennis.
Oh, that's wonderful, and it was nice having you on this episode, doctor. Thank you very much.
Thank you, Lakshmi. It was a nice session.
So this brings us to the end of this episode. We've been discussing about obesity and its treatment options. Do join us for the next week as well. Thank you and stay safe.